Number 6, I asked you to do a few of the activities, but not all of them. The first one that I asked you to do was dealing with the absolute refractory period versus relative. We were playing with a frog heart. Frog hearts have 3 chambers. That is not important. What was important, that you probably thought very aggravating, was that the heart was still alive. And we had to give it nutrition. We had to bathe it in electrolytes, a Ringer solution. And that was really annoying because you heard drip, 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 drip. And believe it or not, that was important. We were keeping the tissue alive. If you look at the picture on page 93 in your PhysioEx, you actually had a screen that was showing you the tension. When the pen went up, this was reflecting systole. When it went down, it was reflecting diastole. You had to time it just right by clicking your mouse to get an extra systole. If you clicked when the pen was on its way up, you did not get an extra systole because the tissue was an absolute refractory period. But if you timed it just right, when the pen was about halfway down showing diastole, and you clicked your mouse again, you did get an extra systole. But a phenomenon occurred that I have not lectured on. After you got an extra systole, you should have noticed that no matter how many times you pressed on your mouse, there was a compensatory pause. And that compensatory pause, if it could talk to you, would say, we need to make sure that all of the cells go through their full cycle of absolute to relative refractory, completely reset. We cannot have twitches summate. If twitches summate, then the ventricles, if we're thinking about the ventricles, which are the chambers that push the blood out of the heart, they would not be able to ever rest. Then that means we would not be able to fill with blood to get the next stroke volume. So having this compensatory pause is like a mandated rest. Do you remember when you were little? I remember going to preschool and kindergarten, and we had nap time. Do any of you remember the mandated nap times? Some of the young ones are like, no, never was I told. Can you imagine such a thing, being told you will nap? And when we were little, we thought that. What the fuck were we thinking? Imagine the joy. If someone says, you're going to take a nap, I'm going to turn off the lights. Here's your blankie. Here's your here's your pillow. You will take a nap. Would you even argue that anymore? Isn't that amazing? When we were little, we hated being put to bed, didn't we? Being told to take a nap. And now as adults, that's all we want to do. So, and your heart is like, fine, you worked me too hard, now I have to take a nap. Compensatory pause. Forced nap time. Doesn't that just bring joy to your heart? I mean, it brings joy to my heart and my brain. Compensatory pause. Activity 2. And activity 2 was so lecture unit 2. If we are stimulating the vagus nerve, do we remember that is giving more control to the parasympathetic division? Heart rate should have gone down. Did you see that? Wasn't that boring? You were like, I already know what's going to happen. Good for you. Welcome to Unit 3. Good for you. Pretty soon you could teach this class. Pretty soon you could be TAs for me. Anyone? No. I'm surviving this one time. Why would I come back to hell? I'm not going to come back to hell. Don't know why Cole/Kyle does it, but Activity 3, I did not assign to you. That is where we dealt with different temperatures. We are not frogs. We do not hibernate beneath ice. That is the reason why I did not assign that activity. You're not frogs. This is human physiology, not comparative physiology. Moving on to Activity 4. Activity 4 was also a revisitation of Lecture Unit 2 for the most part. In Chart 4, we got a baseline read for heart rate. All of you will have slightly different heart rates. But then when you added epinephrine, we should remember from Unit 2 that that was giving more control to the sympathetic division, and heart rate should have gone up. Pilocarpine binds to muscarinic acetylcholine receptors, stimulating them. This gives direct control to the parasympathetic division, and heart rate should have gone down. Atropine binds to muscarinic acetylcholine receptors as well, but blocks them. This is taking away control from the parasympathetic division and indirectly giving more control to the sympathetic division, and you should have seen that heart rate went up. Now, the new one to this discussion was Digitalis. Digitalis comes from a plant called the foxglove plant. And if you watch your cardiac cycle lecture, the rest of it over the weekend, which you don't have to do, I will finish it. But if you want to get ahead, I do think it is helpful for your EKG exam, but not mandatory. It's helpful. You will see on the last 2 slides or so, last 3 slides, I talk about Digitalis. Digitalis is a cardiac glycoside. That means it is carbohydrate derived. It comes from plant material, and it will target your heart. And Digitalis is the only known plant material that will reduce your heart rate. So chronotropy is negative, gives your heart more rest, but at the same time, it increases inotropy. So the heart gets better as a pump. It's a win-win. Give the heart more time to rest, be perfused, and now it will behave as a better pump. Who knew that you would be better if someone would just let you rest more? Are we revisiting the mandatory naps yet? You'd be a better mom, better spouse, better boyfriend, girlfriend, all around better if someone said, just take an hour nap. Other cultures do this. I think they have it right. We do not. So Digitalis makes your heart take a rest, but at the same time makes it better as a pump. The foxglove plant is actually a beautiful plant, and it is in bloom this time of year. It's considered an Easter plant. It's not the Easter lily, but it's similar. It has very long stalks of flowers that are bell-shaped. So to me, it looks like the snapdragon. Long stalks of flowers, bell-shaped. Comes in purple colors, pale pink, white, fuchsia, beautiful, extremely poisonous. So if you have an animal that likes to eat things or a kid that just randomly sticks shit in their mouth, this is not good. Now, a very famous person was being treated with the foxglove plant, and this was Vincent van Gogh. And many times when we prescribe medications, we prescribe them not just for their initial or best use, We have what we say an off-label use. So when people were taking a drug for one reason, we saw benefits for other issues, and that's what we call off-label. So Digitalis back in the day was used to treat manic depression, and Van Gogh was definitely manic. I mean, let's review. He cut off his ear, sent it to a female to profess his love to her. This is not what we do, guys. Send us flowers, send us chocolates. Do not send us ears, toes, or fingers. That's just creepy. But he did that. And he was under the care of a French physician named Dr. Gachet. And Dr. Gachet was giving him the foxglove plant. Now, Digitalis, being a poison, its efficacy and its lethal dose were virtually back to back. It was so easy to over-medicate on Digitalis. And one of the first signs, if you were over-medicated on Digitalis from the foxglove plant, you started to see yellow dots in your vision, yellow spots. That's called xanthopia. And art historians would tell you, if you look at Van Gogh's paintings, he definitely went through a yellow phase. So if you look at my last slide from the cardiac cycle, I show you some paintings from Van Gogh. And one of his famous ones is called Starry Nights. And it's just yellow dots. And that's he got his inspiration from what he was seeing. He didn't know the yellow dots weren't really there. That's what he saw in his vision. Now, his mania got the best of him. And this is where art historians kind of start to argue. Van Gogh, true, with his mania, he actually thought that Gachet was trying to kill him. Now, was Gachet trying to kill him? Could he benefit from that? That's where we start to disagree when you look at art historians and their theories. But what we do know is that Van Gogh thought he was being poisoned on purpose. That could be part of his mental health issue, to be sure. But for sure, Van Gogh didn't paint people frequently. In fact, it was very infrequently when Van Gogh would paint people. And one of the people he would paint, and he had painted more than one time, was Gachet, his French physician. And every time he painted him holding the foxglove plant. And some art historians say that that was Van Gogh's way of saying, I am being killed. Here is my murderer, and here is the murder weapon. He's holding it in my painting. Help. Who knew you'd have history and art in this class? Isn't that cool? Yes? So Digitalis reduces heart rate, but increases the force of contraction. Makes the heart better as a pump, but also gives it a well-deserved rest. Any questions? No?
Is that the same as hypercalcemia?
So it has the same outcome, great question, as hypercalcemia, yes. Greater force of contraction because you have more calcium. But if the heart beats with greater vigor and gets a better stroke volume, then the brain sends a signal down to the heart saying, you're so good. You're so good at that. You are getting such a good stroke volume, you can take a bigger rest between beats because this body just needs 5 liters per minute. I don't care if you eject 100 milliliters per beat or 50 milliliters per beat. But if you eject 100 milliliters per beat, then you can beat less frequently and rest between beats because you're so awesome. But if you're lazy and give me a really shitty stroke volume, then you're going to have to make up the difference. How dare you, lazy son of a bitch, make up the difference. So good analogy. Hypercalcemia, similar outcome to the Digitalis. Good job. Anyone else? Good? Okay, then I'm going to turn off my video.